Okay, here we go. More studying. Ultrasound. So we use ultrasound a lot for therapy, but is there research? Not a lot. It's well designed for animals, good evidence for positive effects on connective tissue characteristics, pain, tissue inflammation, and healing, but not for humans. But we use it anyhow. What is ultrasound? Ultrasound is high-frequency mechanical waves delivered using acoustic energy. Sound waves exert their mechanical action by pressing the initially vibrating molecule into adjacent molecules, which in turn causes them to vibrate. So push, 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 push. These newly vibrating molecules will then transmit their energy into vibrating molecules adjacent to them, so it's a ripple effect. And that is what ultrasound is. Frequency. Frequency, how often? Number of oscillations a molecule undergoes during 1 second. So that hit, boom, how many? Per second. Hertz, measurement of sound waves. So 1 hertz is equal to 1 cycle per second. 1 megahertz, 1 million cycles per second. Wavelength is the distance between 2 successive peaks in the pressure wave. Waves travel in a sinusoidal pattern. So down, up, down, up. Positive pressure phase is compression, pushing. Negative pressure phase is dispersion. So it pushes, releases, pushes, releases. Piezoelectric crystal. It's a source of pressure wave generation. So the piezoelectricity is property of many naturally occurring or synthetic crystals in which the crystal generates an electric voltage when mechanically compressed or expanded. So you're sending energy through this crystal and the crystalline structure actually expands and contracts with that electricity. So it's a chemical bond of the crystal. Hello, physical chemistry. Reverse piezoelectric effect. Voltage is applied, the crystal can compress or expand. The polarity of the voltage depends on whether the crystal is compressed or expanded. So there's a lot of chemistry and physics behind this, and we're not touching that. So no volts, nothing is going on. Add the voltage, it's like smacking something with a hammer. So that's piezoelectric effect. Reverse piezoelectric effect means that there is a mechanical compression. So you're actually physically pushing down on it. And that is the ultrasound. So we are using a reverse piezoelectric effect for ultrasound. And it's actually pushing down and dispersing out, down and out. And it's a rippling effect. How many times per second is it happening? All right, so a 1 megahertz or 1 million cycles per second targets deep tissues. So it's going to go pushing down and out 2 centimeters below the skin. So we talked in the heat and cold about superficial tissue heating is 1 to 2 centimeters. Deeper is anything below 2 centimeters. The same thing goes for ultrasound. That deep tissue is below 2 centimeters below the skin. So if you use a 3 megahertz, or clinically you can use a 3.3 megahertz ultrasound, it targets tissue within 1 to 2 centimeters of the skin, so superficial tissues. So higher frequencies, more oscillations, and more work to overcome molecular friction. More energy absorbed superficially and less available for deeper tissues. So if it's going in fast, it's going to ripple out. And I think a good picture of it would be is if you tossed a bunch of little pebbles. Let's see if that's a good example or not. Trying to think of a good example. All I can think of is water and throwing like a rock into the water. It basically is if you're throwing something really fast at it, then it would ping out, disperse. All right, so modes. Enough with those examples. Modes, continuous or pulsed. So continuous just means it's going to go and go and go, and it's not going to stop until you hit off. Pulsed is defined by the duty cycle. Duty cycle, what the heck is a duty cycle? It's a fraction of time during a single pulse period that the beam of sound is present. So remember, ultrasound is sound. Not that you hear it. Given a percentage, it could be a 50% duty cycle or a 20% duty cycle, and those are the common ones. So if it's 50%, it's on, off, on, off. 20% on, just a little bit here, like a vroom vroom, hitting that gas. So intensity, strength of power or quantity of energy produced by the ultrasound transducer. Power is measured in watts. Power is not uniform across the ultrasound transducer, so you have to keep it going. Actual effective radiating area, or ERA, actual cross-sectional area of the ultrasound beam exiting metal and plate. Determined by size and vibrational properties of crystal. Always smaller than area of metal and plate. Okay. Expressed in square centimeters. So, this is where we say beam, B and R, the ratio has to be at least 5:1, I believe. Yes. Spatial peak intensity, acoustic power of ultrasound beam at highest point. And spatial average intensity. So you have a peak intensity and an average intensity. And when we think about it clinically, we are using the average intensity, but we have to understand that the center point, or somewhere near the center point of that crystal, is a peak intensity. And at that peak intensity, that would be too much. So we have to continuously move that peak so that it doesn't affect one part of the body. So the average intensity is expressed as watts per centimeter squared. Also used clinically as just intensity. Okay. Beam non-uniformity ratio is BNR. Beam non-uniformity ratio. That is the spatial peak intensity divided by the spatial average intensity. The ratio between, peak and average. Determined by quality of the crystal and construction of the transducer. So if you have a really good crystal, it has an excellent crystalline property. By the way, that means it's more expensive, then it's going to be better. Required to be labeled on all machines and is usually listed on coaxial cable of the applicator. Okay. Pulsed mode and intensity. Duty cycle impacts the total energy generated. The spatial average temporal peak intensity of the beam in between interruptions during the pulsed ultrasound. Spatial average temporal average intensity, that's a lot of words, accounts for the impact of the duty cycle. So, let me put this into layman's terms. The spatial average temporal average intensity, so what you're getting out over the treatment area, is equal to the average temporal peak intensity, what that coaxial cable says, times the duty cycle. So you are getting what the coaxial cable says times the duty cycle, and that's going to be your average spatial intensity. So all that means is that if you are working with a 20% duty cycle, you're going to multiply your temporal average by 0.2 so that you're decreasing how much is actually being delivered to that tissue. I'm putting myself to sleep. Clinical application. This is what we want. If you have an old ultrasound machine that does not perform the duty cycle you feel is appropriate, you can use the formula to figure out what parameters to use to get the same power output, because we sometimes don't have beautiful technology here. So for ultrasound at 0.5 watts per centimeter squared times 100% duty cycle, or continuous, once again you'd have 0.5 watts per centimeter squared. But if you are at a 1 watt per centimeter squared, and you don't want that much, and you take a 50% duty cycle, now you're at a 0.5 watts per centimeter squared. So just use some common math skills here. Interaction with biological tissues. So we have gases and liquids and solids. Duh. So we've got some longitudinal waves through the gases and liquids and parallel to direction of energy flow. So the ultrasound is going to flow with the gas and the liquid. So if something has a heavy amount of liquid to it, it is going to go along that path. But if it is solid, like my bone, if you were to do ultrasound right here on the bone, there's longitudinal and transverse waves, so it's going to radiate out. It's going to be perpendicular to the direction of the energy flow. But if you got my tummy, and there's some chub on the tummy, then you are going to be able to get go with it. I should say, if I had fluid around my tummy, you'd go through it. All right, come on, thing. All right, so the interaction with biological tissue, it can be transmitted, it can be reflected, it can be refracted, it can be absorbed. So reflection, coming back at you, and refraction, coming out at an angle, occurs when energy is transmitted through materials of differing impedances. So if you were to go through bone and muscle, bone and muscle have different amounts of water content to them. They are composed of different materials. So you would get reflection off the bone, but you would get some refraction going from the muscle to the bone. Difference between materials is the boundary will determine how much of each. So once again, difference between skin, lots of collagen versus muscle versus bone versus water if you have edema. When energy strikes the boundary at a non-perpendicular angle, at the reflection angle is the same as the strike angle. Okay, so that's reflection. So if you hit right on that bone, it's going to reflect right back up. When energy strikes the boundary at a non-perpendicular angle, the reflection angle is the same as the strike angle. So if I come in at a 60, I'm going to leave at a 60. When energy strikes at a perpendicular angle, the reflection is directly back towards the source. So if I'm coming in, I'm going to come straight back out. Still more reflection and refraction. Standing wave, you don't want a standing wave, bad. Okay, occurs when the reflected wave interacts with waves traveling away from the energy source. If both of these waves are in phase with each other, energies are added. In phase, adding. More intense energy in the tissue, increase heat and burning. So keep your transducer moving. Try not to stay right over bone to decrease that heat and burning. Energy absorption. As sound waves travel through a tissue, all or part of that energy is absorbed, reflected, or refracted. If none of these waves continues to be transmitted to next the change in tissue density, the process continues. So attenuation measures of the decrease in sound energy as the ultrasound travels, either by absorption, reflection, or refraction. Denser tissues with high protein contents absorb ultrasound energy the best. So over that muscle belly. So you would want to be right over my muscle as opposed to my olecranon. So don't go there. Denser tissue. Thermal effects occurs due to friction between the molecules. Lehman reported tissue elevation temperatures of, this is the important stuff, 1 degree Celsius increases metabolic rate. But you're not going to do ultrasound just for increases of metabolism. You're going to get to 2 to 3 degrees Celsius, which reduce spasm and pain and increase that blood flow. So sometimes we're going to do ultrasound just because we're in pain. Let's decrease your pain. Let's increase that tissue by 2 to 3 degrees Celsius. And I'm not going to stick a meat probe into you. I am, however, going to do a calculation to figure that out. And 4 degrees Celsius. So that's collagen extensibility and inhibiting sympathetic activity. So if you have some muscle spasms and you are trying to get some stretching in that muscle, you want to get to 4 degrees Celsius. Yay. Mechanical effects. Microstreaming can affect cell permeability and cellular activity. Cavitation. This is not good. Okay, so might contribute to diffusional changes across the cell membranes and alterations in cellular function. Unstable cavitation. So this cavitation will destroy the tissue, and we do not want this. So not likely during ultrasound at therapeutic intensities. Occurs at high intensities. Violent collapse or implosion of gas bubbles. Tissue destruction may occur. So basically you're blowing up your tissue. We don't want that. Muscular effects to heat the muscle tissues. Lower that frequency, 1 megahertz. Higher intensity, watts per centimeter squared. Longer duration, it's going to take more minutes to accomplish that treatment. To heat superficial muscle tissue, increase that frequency, 3 megahertz. Higher intensity and shorter duration. It won't take as long. So here is the triceps surae, the calf muscles. So this is important. Intensity. 1 megahertz at a 0.5 watts per centimeter squared. In 10 minutes, you're going to get a 0.5 increase in temperature. No, thank you. At 1 megahertz and 1 watt per centimeter squared, you are going to get to, in 5 minutes, on 1 degree. In 10 minutes, a 1.75 degree. Not very useful yet. But if you use a 1.5 watts per centimeter squared and you go for 7.5 minutes, you're going to get 2.5 degrees Celsius increase. So that would be beneficial for that muscle spasm and pain. But if you are going for extensibility of the muscle, you want to get to 2 watts per centimeter squared, and by golly gee, at 10 minutes you'll get to 4 degrees Celsius. And it goes on to say 3 megahertz as well. So ultrasound mean or average muscle temp increases. Intensity of 0.5 watts per centimeter squared at 1 megahertz. You're going to get 0.04 degrees Celsius per minute. That's piddly. And at 1 watt per centimeter squared with 1 megahertz, you're going to get 0.2. per minute. So if you wanted to get to a 4 centimeter or 4 degrees Celsius change in tissue, 0.2, 0.4, 0.6, 0.8, 1. It would take 5 minutes to get to a 1 degree change. 5, 10, 15, 20. It would take 20 minutes to get to that 4 degree change. At 1.5, you're increasing by 0.3 degrees Celsius per minute. And at that 2 watt per centimeter squared, you're increasing by 0.4. So 0.4, 0.8, 1.2. So in 3 minutes, you're already to that 1.2. So that's a much more functional intensity. And then for the 3 megahertz for the superficial tissues, like, hello, wrist extensor. Then, for instance, if you had an intensity of 2 watts per centimeter squared with a 3 megahertz, you're getting to a 1.4 degree change in 1 minute. So you would only want to ultrasound my wrist, for instance, for 2 minutes to use it for pain. So interesting. All right, halfway through this. Connective tissue effects. Tendons and ligaments heat up faster than muscle due to high collagen content and avascularity. Chan and colleagues, research moment, found that heating effects at the patellar tendon reached required minimum of 4 degrees Celsius. Maintained for 15 to 20 minutes, stretch immediately following or even during ultrasound. So you can have them do functional motion while they're being treated. Hemodynamic effects. Ultrasound energy is absorbed by tissue and temperature elevates. Local blood flow therefore also increases to dissipate heat and restore homeostasis. Research, 50-50 at best. Based on the evidence, small treatment, 1 megahertz, a minimum of 5-minute treatment time. Great. Effects on nerves. This is the cool stuff right here. Motor nerve conduction velocities. Research shows they can decrease, increase, or remain the same depending on parameters of treatment. That doesn't sound good. Sensory nerve conduction velocities appear to increase with thermal doses of ultrasound. So if we, changing my position, if we are using deep 1 megahertz, and if we're trying to increase to 4 degrees Celsius, a thermal dose will increase the nerve conduction velocity for sensory. Increase pain threshold, possibly. Unclear if actually due to ultrasound or associated vascular and thermal changes in the treated area. So we don't know if it's actually the heat that somebody's enjoying or if it's something else. Inflammation and tissue repair. In vitro research shows ultrasound to have an effect on cells during acute inflammation and tissue repair. Collagen synthesis, cellular proliferation, increase in fibroblast proliferation. Wound healing. Animal studies show increased wound healing with increased new vessel formation and collagen deposition. But it's an animal study. Muscle healing and contusions. More animal studies. Wound healing. Human trials are inconclusive. Muscle healing. Possible increased fibroblasts during healing phase. Possible increased force production. Overall, it's unclear if ultrasound would be an effective treatment. Great. All right, peripheral nerve healing. Here we go again with those animal studies. Low intensity may help. So the low intensity was the 1 megahertz. Increased amount of regenerating nerve fibers, myelinization, diameter of nerve, and Schwann cell activities of sciatic nerve of rat with pulsed ultrasound. So they're trying to get that nerve to regenerate and they used ultrasound. My golly, more animal studies for tendon and ligament healing. Ultrasound to the Achilles tendon in rats had more densely aggregated collagen fibrils with parallel alignment. Increased tensile load. However, no changes with chicken tendons. I want to know who does this. Dogs resumed normal gait sooner. Evidence of more advanced healing relative to controls. So, why the dog? Why the rat, but not the chicken? Human studies for tendon and ligament healing. Lateral ankle sprain. No support for use of ultrasound. So if you have an if you have a lateral ankle sprain, don't use the ultrasound. Shoulders. Don't use the ultrasound. Unless it's calcific tendonitis of the shoulder. All right, let's keep reading. Fracture healing, articular cartilage repair. Ultrasound used in form of a bone stimulator. Effective in healing non-union fractures. So if something doesn't want to heal, ultrasound it. Most studies done on animals, hello animals again, using a sonic accelerated fracture healing system. So it wasn't a normal clinical ultrasound, it was a sonic accelerated. All right, so the instrumentation of ultrasound. Basic components, you have a console, you have a coaxial cable, and you have a transducer. And you can have either a small transducer or a large one, 5 centimeters squared or 10 centimeters squared. So, when do I use ultrasound? Why do I use it? Deep heat. You need more for that heat. And to facilitate healing. Joint contracture and scar tissue, pain and muscle spasm, subacute or chronic soft tissue inflammation requiring increased temperature or blood flow. So subacute, not acute because we're going back to ice for that. Chronic soft tissue inflammation, pain, muscle spasm, joint contracture, scar tissue. Facilitate that healing, fractures, open wounds, acute injury, inflammation of soft tissue, peripheral nerve. But the research is really still out on that peripheral nerve stuff. All right, contraindications and the region of a cardiac pacemaker. During pregnancy, over the abdominal, pelvic, or lumbar region, over eyes, over testes, and a region of active bleeding or infection, in a region of tumor or malignancy, and a region of deep vein thrombosis or thrombophlebitis, over the heart, stellate or cervical ganglia, over epiphyseal plates or growing bones, so if I was still growing, over the spinal column. Don't use it on the spinal column. Do not cross the beams. What is a stellate ganglia? The stellate ganglia is a collection of nerves found at the level of the 6th and 7th cervical vertebrae, the last vertebrae of the neck. The nerves are located in front of the vertebrae. They are part of the sympathetic nervous system and supply the face and the arms. Don't go over those. Precautions. Sensation of area being treated. So you have to be able to feel it. Communication or cognitive deficits. So you need communication between you and the patient. Poor circulation or vascularity. So once again, deficiency in circulation, don't do it. Treatment over plastic or metal implants, don't do it. So bone cement for spinal fusion is highly absorptive. If you have screws or plates in your bone, don't do that. Metal is highly reflective, increases risk of standing waves, and increased heat or unstable cavitation. All right, so application technique. Move the sound head. Decreases risk of standing waves, increases patient comfort, allows for more even spatial distribution of energy. Treatment area should be 2 times the area the head of the transducer. So if your transducer is this big, area is this big. All right, stationary sound head used in bone stimulators. Parameters are fixed and device has multiple crystals. So that's different. We didn't really do that. Application techniques. Direct contact coupling. Ultrasound waves do not travel effectively through the air. They just don't. Coupling medium is required to transmit energy between transducer and patient's body. So we're going to use some gel. So use direct contact where area of treatment is flat and as large as a transducer face. Use of water-soluble gel or lotion is placed on the patient's skin and direct contact is made with the transducer and the gel. This eliminates excess air, reduces reflection back on the sound head. Application techniques, indirect coupling methods. If direct coupling causes pain or an area is too bony or small to have direct contact, one of the following methods may be used. Water immersion method, which seems counterintuitive, but you immerse the body part in water and the transducer is moved over an area about 1 to 2 centimeters away. Plastic basins are better than metal due to the reflection. So stick your hand in that. Tissue temperature change is 40 to 60% lower with this method because you have to heat the water too. Gel or water-filled waters or packs. So you put your hand in one of those like gel packs and then do it over that. Phonophoresis. Use of ultrasound to enhance delivery of medication through the skin. And this is kind of cool. Theory is that ultrasound enhances the transdermal diffusion of medications through such mechanisms, dilating points of entry, so the hair follicles, sweat glands, increasing local circulation. But once again, if you have poor circulation, don't use it. So whatever. Increasing kinetic energy of local cells and the medication itself. So you're heating everything up. Everything is more active. All the chemical bonds are looser. So it will be more readily absorbed. It increases cell membrane permeability. Yeah. Hello, sweat. All right. Measurement and expected outcomes. Pain assessment, tenderness to palpation. Range of motion measurements. Flexibility assessments. Wound measurements. How big is that thing? Manual muscle testing. Push back, push back. Those kind of things. Documentation. What do I document? Frequency. So how many did I use? A 1.0 megahertz. Did I use at 3.3? Intensity was I at 1.5. Was I at 1? Duration. Was it 8 minutes? 10 minutes? Mode. Was it continuous? Was it a 50% duty cycle? Treatment area. I was on my upper trap. I was on my flexor retinacula. Whatever. Patient position. Were they seated? Were they supine? Were they prone? Were they in high Fowlers? Where were they? Transducer size. Was it a 5 centimeters squared area? 10. Sequence within treatment session. Okay. Clinical controversies. Can ultrasound be safely applied over epiphyseal plates in children? We should probably not do that right now. Can ultrasound be used for patients with cancer? Controversy. Is pulsed ultrasound indifferent or better than continuous ultrasound delivered at an equivalent intensity? So if you have one of those old school machines versus a new one where you can change stuff. Is target tissue depth the best criterion for choosing a treatment frequency? Or is it time? Are treatment parameters and research findings from ultrasound studies using animal models useful or relevant for making clinical decisions about patient treatment with ultrasound? And that is it for ultrasound. All right.